Calculating blood alcohol content and driving impairment, Part 2. What impacts the BAC? You may control how much alcohol enters your circulation by paying attention to the following factors. Pounds. People who are heavier typically have more fluid in their bodies than those who are lighter. Even when the same amount of alcohol is consumed, fluid dilutes it, lowering the blood alcohol concentration, BAC. The percentage of body fat. Compared to muscle, bone, and other body components, fat has a lower water content. A person with a higher body fat percentage will have less fluid to hydrate themselves, resulting in a higher BAC from the alcohol they ingest. Loss of water. A person who is dehydrated won't have as much fluid in their system to dilute alcohol. Gender. Women frequently have greater BACs than men who have taken the same amount of alcohol because they tend to have less water in their bodies than males. Food. When you eat while drinking, the amount of alcohol that enters your bloodstream can be slowed. Although this effect is small, it does indicate that someone who drinks on an empty stomach will likely have a higher BAC than someone who eats before drinking. Carbonated beverages. Beer, champagne, and soda are examples of alcoholic beverages or mixers that are hypothesized to cause blood alcohol levels to increase more than non-carbonated beverages of the same strength. According to experts, this is caused by excess gas in the digestive tract speeding up absorption. Consumption rate. Your blood alcohol level is influenced by how long it takes you to ingest a measure of alcohol. Drinking a single shot of whiskey in one hit will result in a higher BAC than sipping the same shot of whiskey mixed with soda over a longer period of time. Drugs. Alcohol is known to interact with some illegal and prescribed medications, causing your body to absorb it more quickly or more slowly than usual. Your age, genetic makeup, tolerance, how acclimated you are to consuming alcohol, and emotional state are all thought to affect blood alcohol concentration in addition to the elements already mentioned. It is quite difficult to predict how your body will react to consuming alcohol and if you will go over the limit because there are so many different factors to take into account. It is recommended to stay away from alcohol entirely if you plan on driving. Calculating the amount of alcohol in your blood. A breathalyzer test is the most reliable technique to measure your blood alcohol level, or a blood test. If you know exactly how much you drank and when, you can calculate your BAC using other scientific techniques. The formula shown below can be used to determine someone's blood alcohol content, however keep in mind that the result is merely an estimate. Do not use this method to determine whether you are too intoxicated to drive. You will require the following details in order to use this method. 1. The weight of your body in pounds. 2. The number of ounces of alcohol you drank. 3. The number of hours since you first started drinking. Additionally, you must be aware of the typical rate of blood alcohol concentration decline, which is 0.015% each hour. You only need a pen, some paper, and a napkin to write on in order to compute your current BAC. Because the average body composition of men and women differs, the calculation will be slightly different for each gender. Your gender determines the 8 or 10 value in the center of the following calculation. While women should use 10, men should use 8. Alcohol in ounces x, 8 or 10, weight in pounds, 0.015x time in hours. Here is a detailed explanation of how to use this formula. Add 8 or 10 to the amount of alcohol you drank, based on whether you are male or female respectively. The result is divided by your weight. We'll go back to your BAC in a second, but for now, let's look at it now. The time is then multiplied by 0.015. Subtract this amount from the total you arrived at after stage 2 before adding it back. Your estimated blood alcohol content is shown by this number. As meals, carbonated beverages, the amount of fluid in your body, and your tolerance to alcohol will all affect your BAC. Keep in mind that the result may not be correct. Examples of BAC calculations. Let's go over a few instances to demonstrate how this BAC calculating algorithm actually works. Instance 1. A 160-pound male consumes 4 standard drinks, which equals 2.4 ounces of alcohol, 0.6 by 4. He started drinking at 9 p.m., and a breathalyzer test is administered at 12 a.m. Will he exceed the cap? 8.4 times 2.4 ounces is 19.2. 160 pounds is 0.12 BAC. Before time passes, 3 hours multiplied by 0.015 results in 0.045. 0.12 to 0.045 equals 0.075 BAC. This approach suggests that the man in this scenario shouldn't be over the legal limit of 0.08% when requested to submit to a breathalyzer test, assuming he didn't drink the majority of them later in the evening. However, as we previously covered, a wide range of additional factors can affect a person's blood alcohol level. A BAC of 0.075% is dangerously close to the limit and is high enough to impair driving. This result should be high enough to persuade the person in the example not to gamble on whether they could drive safely and lawfully by 12 a.m. using this computation.